Hello, we're answering questions on health and medical problems. I'm joined by Dr. Rosemary Leonard. Hello.
Hello.
Rosemary, we've got a question from an apprehensive mother. Her 7-year-old son's due to have an operation next week. And with all the reports of MRSA in the papers, she's really getting herself quite worked up about him contacting the bug. And she's wanting to know, what are the chances of this happening?
Quite a lot of hospitals now are screening all people before they go in for routine elective surgery, planned surgery, and that includes children. It involves having a nasal swab taken because it may be he is carrying MRSA already. And if he is carrying it already, he will be more at risk of then getting an infection in a wound when he goes into the hospital. So if she wants to check, she can always ask the doctor, her own GP can take a nasal swab to check if he's carrying it. And if he is, there is treatment he can be given. Otherwise, when he actually goes into the hospital, what she has to do is make sure that she observes all the hygiene measures, washing her hands carefully before she goes to see him, using the alcoholic hand rubs, and also just checking all the other visitors he has do the same thing. I mean, it's difficult in a children's ward because quite often if they're in for a few days, they do play with one another, but you would hope that at the hospital would isolate any child that had got the infection.
And remind us about this infection, because it's taken on a life of its own in terms of the fear factor. We kind of all talking about MRSA, but what is it? Take us back to the basics of it.
What it is, it's a type of Staph aureus, which is a very common bug that lives on the skin that is resistant to several types of antibiotics, including one called methicillin. So it's called methicillin-resistant Staphylococcus aureus. But there are actually some antibiotics that can be used to treat it, but they tend to be very powerful antibiotics which can cause side effects. And what can happen is if you get MRSA in a wound, it can be difficult for it to treat. But generally with a child has a very good immune system, and unless he's got an underlying severe illness, it would be unusual for an MRSA infection to really make him very ill. The people who tend to succumb to MRSA, or where it's much more of a problem, are the elderly who've got other health problems.
Well, very good advice, Rosemary. I'm sure she'll be quite assured to hear that. Now, if you have a similar problem, we hope we might have given you some help, but remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.